Welcome back for part two. We're almost done. I had a question for you, and if you email me, you can get a virtual ticket. So I want to know what the difference between sanitation, disinfection, and sterilization are. It's really important. We've worked on it all last semester and gone over it, but it does get confused often. So email me what the difference between sanitation, disinfection, and sterilization are, and I will give you a virtual ticket. So talking about drapes and suturing, this is something that we, help with as far as being the medical assistant, because we assist in making sure that the doctor has the proper tools needed at the proper time and that the patient is prepared and draped correctly. So we use disposable surgical drapes, and they are placed over the operative area using sterile technique. Typically, the area that is we're keeping clean, so to speak, is a blue drape. Sometimes it is a white fenestrated drape. It just depends on what they use in the office, but typically they use the blue fenestrated just to really remind us that that whole area is sterile and that we cannot break that sterile field. Also, ideal suture material is easy to handle and it's non-allergenic, strong without cutting through tissue, and it can be sterilized. Again, this will depend on what the doctor prefers and uses. So there are different types of suture materials. We have absorbable sutures that are dissolved by the body during the healing process, and this is used for deep incisions and lacerations, or when removal would be difficult. And then we also have the non-absorbable suture material, and it is left in until the healing is complete and then removed. And we can, by scope of practice, remove these sutures as well as surgical staples. So surgical staples are made of stainless steel or titanium. They are placed in until the healing is done, and then we as medical assistants are also able to remove the staples. So we'll be learning suture removal and staple removal, which is a lot of fun. So what common material is often used for non-absorbable sutures? So the common material used for the non-absorbable suture material is silk, because it's strong and easy to tie, and it's treated with a coating, and it prevents that tissue to drag and flake along that silk suture. There are different sizes and types of suturing, so please make sure to take a look in your book at figure 3228 at some examples of the different suture sizes and types. Needles are manufactured with the suture material attached or swagged to the needle. So the needles come with that suture material. So it's important to read the needle size and understand what your doctor likes and prepare the correct needle size and suture for him. Surgical needles are chosen according to the area in which they are to be used and the depth and width of the desired suture. Point of a needle can be a taper or a cutting edge, so the needle point can look a little bit differently. And again, it's important that you know exactly what your doctor is wanting and how he wants that prepared. Make sure that you take a look again at figure 3229 for the suture needle with swagged suture material. And patient education is always our main important job. So we want to make sure that the patient's fears are addressed and answer all of their questions about what will happen, about the surgery, about what instruments are being used, and what they can expect in the healing process. Explaining the patient preparation for the procedure, how the procedure is performed, and what to expect afterwards helps make this procedure go way more smoothly, and it encourages the patient to follow the advice and orders of the doctor. As always, we have legal and ethical issues. The better the patient's understanding, the greater the likelihood that he or she will comply with the pre-surgical preparation and the post-surgical care. So know what surgery is planned and whether the patient has been informed about the procedure. Realize the full extent of your role as the patient advocate and the physician agent, and confirm that the physician has explained the surgery to the patient and that the patient has signed the informed consent. Informed consent is key here because the physician cannot do any of the minor surgeries if this informed consent has not been completed. And that's a big, big role that we have, which is to make sure that informed consent gets signed, and then also to recheck and make sure that that was done prior to starting the minor surgery. Well, that was a quick run through of surgical instruments, and I think that you will do great, especially if you just really understand those categories and what they are. If you have any questions, please bring them to class. I hope you have a great day. See you soon. Bye.